I think that's one of the things that is really having maybe an underappreciated impact on society is the lack of the free access to the performing arts. I mean, dance and ballet and plays and acting. I mean, you asked me the question, what's the thing? The last thing I saw in the performing arts was Hamilton at the Kennedy Center.
Yeah.
So, I mean, Hamilton is obviously a unique in its magnificence, but there are so many things that you take for granted is the accessibility of the performing arts, whatever it is that you like best, whether you like musicals, serious plays, symphonies, operas, whatever suits you is almost always there for you to pick from. The fact that we've been closed off from so many things in society, I think being closed off from access to the physical presence of the performing arts has really been one of those things that I think adds to the gloom of the situation we're in. Thank goodness for television, really, quite frankly, getting some of the things that are brought into our home, but there's nothing like being there in person, the electricity that you feel when you're in the audience, when something is being done live. We all long for that to come back to its normal place in society.
Last fall, you told us that it might be the middle or end of this year even before things return to a semblance of normalcy. Are there any updates right now on the timeline that you are seeing from your end?
Well, Maureen, the timeline won't change if what I would hope happens, in fact, happens. And that is that we need to vaccinate between 70 and 85% of the population to get a level of herd immunity where the virus is in such a low level in society that it's virtually no threat to anyone. In other words, do with SARS-CoV-2 what we did with polio, what we did with measles, and what we've done with many other infectious diseases. But that only happens if you have people take up the vaccine.
I want to ask you to just talk a little bit about asymptomatic spread, because one of the things I know folks struggle with is feeling that they are not in danger themselves or endangering anyone else if they don't have symptoms.
Yeah. So we know that it's somewhere around 40% of all the people who are infected have no symptoms at all. And we know that about half of the transmissions occur from a person who is either pre-symptomatic, namely doesn't have any symptoms but will soon develop symptoms, but you don't know when you interact with them because they don't have symptoms then. And about 20 some odd percent is from people who will never ever get symptoms. So a little bit more than 50% of all the transmissions occur from someone who has no symptoms. That is very, very problematic, because if you don't know who's infected, you have so many people walking around in society who are infected, who feel perfectly well, who are inadvertently and innocently infecting other people. Now, the fact that they don't have any symptoms is fine for them, but as they infect other people, sooner or later, they're going to infect someone who is either elderly or who has an underlying condition that makes them more susceptible to the severe outcome of infection. So particularly young people who might, maybe understandably, but certainly incorrectly, think that if they get infected, since the chances are that they will have no symptoms, what difference does it make? They're going to get infected and they're going to get better, even though they don't have any symptoms. Well, the difference it makes is that you're propagating the outbreak. And it is likely, since you don't know that you're infected, that you will infect someone else, who will then infect someone else, who will then infect someone who does have a serious outcome. So you may not realize it, but you may be responsible 2 or 3 generations of infections down the pike that you're actually responsible for somebody getting seriously ill and maybe even dying.
Thanks. And one final question specifically about the vaccines from the audience, which is, can people who have been vaccinated feel safe in going anywhere, performing on stage with band members, living in other households, or sitting in an audience where only some people have been vaccinated?
No, because A, you don't know if you are completely protected, even though it's 94 to 95. But importantly, we know that the vaccine protects you against symptomatic disease, but it doesn't necessarily, we don't know this yet, it might, but it doesn't necessarily prevent you from getting infected. So you can get infected and have no symptoms and then think I'm fine, I'm not getting sick, but you could have virus in your nasopharynx and pass it on to somebody else. And that's the reason why we say that even though you've been vaccinated, you should wear a mask, except when it becomes impossible to wear a mask, which would be a little bit of a risk, but not zero. So for example, if you're vaccinated and you're on stage with other actors interacting and they're all vaccinated, the chances of your getting infected are very, 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 very low. So I wouldn't worry about that. But when you get into society, sitting in a crowd, you still should be wearing a mask.
As we talked about already, the performing arts has been devastated, absolutely devastated by the pandemic, with sudden and unexpected facilities closures, programming cessations, tour cancellations, abrupt revenue loss, the list goes on and on. Of course, we are all ready to get back to work and know things are going to be pretty different when we do. And I'd love to get your perspectives on some of the things that are on the minds of the folks in this audience. I'd appreciate hearing a bit about the relative danger posed by attending live performance versus going to restaurants, bars, and gyms. And then related to that, a question about the fact-based safety differences between religious gatherings and live performances, and what presenters can think about to demonstrate parity, if that is appropriate, to those who state governments who are making the rules around what gatherings can and cannot occur.
Yeah, and I think that requires some studies. You know, there's a German study going on right now where they're doing various scenarios in closed theater-like situations for a rock band performance and trying to determine whether you're 3 seats apart, what kind of ventilation, et cetera, et cetera. But I understand the subtext of what you're asking. And let me word it in another way, because you were so tactful in the way you asked it. So if some states are opening up bars and gyms and restaurants, why are they not allowing theaters to open? Right? That's what you're saying.
I admit, yes.
Okay. No, and if people who are very intent on maintaining their religious connection are demanding that you don't have any restrictions on churches or choirs, why in the same context are they saying you can't go in a theater to watch a play or to watch a symphony or to watch a ballet? So the answer is that I think what the performing arts need to do is to do a little bit more of what the Germans are doing. So for example, if you did a study that you had a real good engineering look at ventilation in a theater and make sure you have the kind of airflow that essentially blows up and out as opposed to on top of the people. I mean, I'm not an expert in that, Maurine, but I would think that some simple engineering consultation could tell you that you could maintain the airflow. The other thing, and I'm making a suggestion, but one of the things that you should consider is, you know, there are these HEPA filters that they have in the planes, which makes the airline industry say, we have the airflow and we have the HEPA filters. For modest duration flights, it's pretty safe. I think for 18-hour flights, all bets are off. But for moderate, you know, flying from New York to Chicago or New York to Boston, those kind of short flights, I think good airflow and HEPA filters can work.
Yeah.
It is not a big deal to make investments in some industrial sized HEPA filters for the theaters. I bought a couple for my own house. It was like $49 on Amazon.com. It was not a big deal. I think if you get an industrial size one, it may cost several hundreds of dollars. You put a bunch of them in the theater, I think you could do a test to show that that's quite safe if you have good ventilation and HEPA filters.
And just for those of us who are watching today who may not be really familiar with that study from Germany, among their findings were that there was not a much increased transmission risk, and it could in fact be reduced through wearing masks, good ventilation, as you were just talking about, having people consume concessions seated in their assigned seats rather than in common areas, having multiple entrances and that sort of thing. And the combination of those measures really make attending performing arts events quite safe. So related to that, Dr. Fauci, there are performances happening in other places in the world. Of course, they are happening in China, for example, but Australia and other places. What are the differences? Like, how come they can do it safely, and that feels like an acceptable risk there versus what's happening here in this country?
So, Maurine, it gets dangerous when you compare us to Australia and New Zealand and places like that.
Mm-hmm.
The level of infection in those countries is extraordinarily much lower than here. You always got to put into the equation, what is the level of infection in the community? If you have a very low test positivity and there's not a lot of community spread, you could feel much, much more relaxed about going into a theater and maybe taking every third seat or getting good ventilation. But when you have 280,000 infections a day and over 4,000 deaths per day and 150,000 hospitalizations, it really doesn't matter what you do, you're really at risk. So one of the best ways to get the performing arts back, in addition to what we have been talking about now with ventilation and seating and HEPA filters, is to get the level of community spread as low as you possibly can. And you could do that by two things. One, by public health measures, wearing masks, physical distancing, avoiding crowds, particularly indoors, washing your hands. But the other aspect of that is vaccination. And that's the reason why it's important for us to implement as quickly as possible a sound vaccination program.
And so, you talked about mask wearing in places in Asia, for example, and one that might be a thing we want to think about going forward. And also ventilation as something that this field can start thinking about sooner rather than later and investing in. Are there other things that we haven't talked about already that would be important to think about on a permanent basis in terms of significant change to performing arts venues and the way that performance happens here?
Well, having readily available hand sanitizers is another one. The other thing that I think, if we don't get control with a vaccine, that I have been talking about for months now, is to make widely available to the general public point of care, sensitive and specific 10-minute tests that are affordable and that you can get without a prescription from a physician, so that you can take a test, and if you're negative, you walk into the theater. If you're not, you go back home.
For many performing arts organizations, and especially for the artists and the managers who work with them, touring revenue is really the lifeblood of their careers. What's your advice going forward about how they can safely tour once that is permissible, without taking undue risks, and what systems need to be in place to accomplish that?
Well, again, Maureen, it's a question that seems like a simple question, but it becomes very complicated because where are you touring to? Let's fast forward. Let's say you're in New York and the level of infection has gone down. People have been vaccinated. You're in good shape. And you want to tour to Tulsa, Oklahoma, except that Tulsa, Oklahoma is red hot with infections. That's very different if you want to tour to Philadelphia, where the infection rate might be really, really low. We're a big country. It depends on where you're coming from and where you're going. And I think all you need to do is exercise those very well established public health practices that I mentioned multiple times.
Mm-hmm. And so that's implications for routing of tours that
Right.
booking managers are already thinking about, but just another layer to add on to thinking about how to put tours together. I want to shift a little bit again to just really talk about how the performing arts field can be really enlisted to help make things better sooner. The incoming administration has set a goal of getting up to 1 million vaccinations per day. I think we're still a little ways off from that, is the latest information that I've read. I'd love an update from you about that. But then I'm curious what roles, if any, there might be for the performing arts field. Artists, arts organizations, arts professionals, folks who work on the technical side of things. How can we help get us to the finish line on this sooner rather than later and in good order?
Well, I think it falls under the category of setting an example for the rest of the country. So there are two things that the performing arts can do. You can help with the vaccination program by having people look up to who their heroes are. So the people who love the performing arts, you get the top ballerina, the top performer, you get Lin-Manuel Miranda getting up and getting vaccinated in front of everybody. I think people will see as an example that maybe they don't have to be so skeptical about vaccination. Also, you could use the theater as a location where vaccinations occur. Come pick up your ticket for tonight's performance, go off into the booth and get vaccinated. I mean, you could be very creative about that and
Yeah.
work with the local public health officials.
Yeah, I mean, it's interesting because there are lots of ways that there are organic connections, stage managers who are very used to dealing with logistics, front of house staff who can really help direct people and keep them socially and physically distanced. These venues tend to be significantly sized that can accommodate people in safe ways. And then there are the public health campaigns. And of course, dance artists have been offering online classes so people can safely exercise while they're in place, and music and theater artists, of course, are streaming performances and other content and workshops to help people stay connected. And those artists, in fact, are contributing to people's overall well-being. I'm wondering if there's anything else we can be doing that we haven't done so far. Can we, besides acting as vaccination sites, is there a way for some of us to be trained to play more active roles in actually vaccine distribution and that sort of thing, given that stage managers, again, and production personnel deal with logistics and that sort of thing? That's a little bit of a stretch, I understand, but I gotta ask it because people want to know.
Well, that is a stretch. If you don't have enough, I mean, we do need people out in the trenches vaccinating. You get doctors and nurses, but in some cities where doctors and nurses are completely swamped with taking care of desperately ill patients, you need to go to another level. We often speak of medical students and nursing students, but you could train lay people to administer vaccines. That's easy to do. In developing countries, we do that all the time, that we get people, even young people, teenagers, 17, 18 years old, get in, give them a couple of days worth of practice, and they could get out in the field. I think that could be something you could do. It's a bit of a stretch, but come and get vaccinated by whomever your favorite performer is.
We want to know how we ensure audiences are COVID-free with the challenging intersection of privacy laws. We've even seen people talk about things like vaccination cards and the prospect of asking people to show their vaccination records in order to enter a performance.
No, you could do that. There's precedent to that because there are a number of airlines right now. You can't get on a plane unless you show you're negative. I mean, there are a number of countries that right now are saying you can't get on a plane to go from one destination to another unless you show that you have been vaccinated within the last 48 to 72 hours. So vaccination requirements on transportation can be easily extrapolated to the theater.
And what procedures do you think should be followed by indoor venues in the fall and winter of 2021, assuming public health guidelines allow for it, once a good amount of population has been vaccinated, once we've reached herd immunity, I think is what's being asked?
Well, I think, the indoor venues should, again, it's a reasonable question, Maurine, but it depends on the level of infection. If you have a low level of infection and most of the people are vaccinated, we may get to the point where I said what I hope it's going to be in the fall, where everything is back to normal. You got the overwhelming majority of people vaccinated. You come in, the only requirement might be to wear a mask, particularly if the indoor venue is well ventilated and maybe has some HEPA filters. I think you could then start to getting back to almost full capacity of seating.
Right. And then we just, as presenters, have to think about how we are monitoring the wearing of masks. I was just looking at an article on The Guardian day before yesterday. It was a snapshot of people in an audience in Sydney, Australia. They all had on masks. They'd been required to wear masks. But as I scanned that photo, I think 2 people out of what looked like a crowd of over 100, only 2 of them had covered their noses and mouths. Everyone else had it either under their chin or across their mouth only and that sort of thing. So for us in the presenting field, it does have implications for really having an audience be not only safe, but comfortable as well and welcomed in the space. So that's something that we'll have to do a little homework on. Can we safely hold performances outdoors? There are a number of our members who, in fact, present and program outdoor venues. What's required to do that? What do we need to know to have that happen in a responsible way?
Well, it is being responsible just by doing it outdoors. Outdoors are much, much safer than indoors. I mean, if you're out there with the natural breezes that blow respiratory particles away, it's so much safer. That's the reason why many, if not all, I wouldn't say all, you never have all in biology, but the overwhelming majority of super spreader events are those that occur indoor as opposed to outdoor.
But many of APAP's members really work on promoting, creating, and presenting work for young audiences. Given what we know now, when do you expect it will be safe for children to return to the theater? For example, school trips to participate in performances?
Again, it gets back to what I said. I think that if we roll out the vaccines the way I hope we can, where we start having open season that anybody can get vaccinated starting in April. You have the priorities that are getting vaccinated now, healthcare providers, the elderly, people with underlying conditions. By the time we get to April, I would hope that we would have the overwhelming majority of those people vaccinated. And then you could have open season in April, May, June, July, and August to get everybody else vaccinated, including children. I think by the time we get to the fall of 2021, that we're going to have anybody, including children, can go to the theater.
And so another thing is, what's the forecast or timeline in your estimation for allowing international artists to come back into the U.S.? What federal health guidelines are being developed to address that? Because again, that's a large part of our industry as well.
I think, again, that's going to depend on where they're coming from, what country. If they're coming from a country that is quite well controlled with regard to the virus, then I think it'll be very easy to come back. I worry more, since our country is such aflame with infections, you know, over 200,000 per day, close to 300,000, over 4,000 deaths per day, that other countries will not want us to go there,
right,
as opposed to other countries wanting to come here.
What is estimated to be the efficacy of the vaccine? Or I think the question is really about how long will the vaccine's efficacy last? That's the question.
Yeah, we don't know for sure, because we've only been doing this for less than a year, but it is likely that it would be at least a year. We know that it's probably 8 months already, but it could be much more than a year for all we know. We just need to follow it over a period of time. You can't make a prediction of how long it's going to last when we've just started vaccinating people over the last several months.
Are there things that I haven't asked, that we haven't covered, that we haven't examined from different angles, that are important for us to know, to understand, to consider? What are your final words of advice for us, in other words?
Well, my final words are that I want people, I know, because we're suffering from COVID fatigue in this country. This week is really like the year anniversary of when, the first case in the United States was recognized on January 21st. So we're just a couple of weeks away from the 1 year anniversary. And people are really worn out from this. So my message is, don't give up. Help is on the way in the form of vaccine. Continue to implement the public health measures that we know work, and we will get out of this. This will end, and we will be back to normal. We'll be back in the theaters. Performers will be performing. Audiences will be enjoying it. It will happen.
We look forward to that day. Dr. Fauci, thank you again so much. We appreciate your steadfastness, the information, the reassurance. We also appreciate your stamina, because we know that you have been basically nonstop doing these information sessions, and they're quite helpful to us. And once we get to the other side of this, rest assured, we will be looking for you in our audiences. So we hopefully sooner rather than later. Thank you again. And please take good care. Be well.
Thank you, Maureen. Good to be with you.